Hi, I'm Kim Harris. I'm the Marketing Director for HASA. Today's video is to help with the training for patient consent materials for an organization who's sending data to our HIE to the community portal. So we're quickly going to go over the patient education materials as well as a training outline, requirements for participating with an HIE, and then we'll talk about the forms and what is required to let us know when patients do want to opt out or revoke their opt-out. So we'll be moving through this kind of quickly, so if you have questions, you can always contact HASA directly to get more information. So these, the CLING and the patient education brochures are displayed on the screen currently. You'll see the Health Records on the Go brochures are intended to match the CLING stickers. The CLING are intended to be put around your organization in all the patient access areas, front door, the admissions department, help desk, anywhere that it would be important for your patients to, to become aware that their information is being shared with an HIE. They're orange and bright and are intended to alert them to seek out this patient education material so that they can learn more about it. These materials have been designed to just make patients aware of the risks of not sharing their information with an HIE. The real ultimate goal for having this information available is so that in emergency situations, if a patient is unconscious or if in an emergency the patient's information needs to be accessed from a different facility from where they're seeking treatment, that this information is available to their physician. So the patient brochures are designed to explain the reason why the patient repository is available, as well as who has the right to access and what their rights are as far as not sharing that information. So it's important to notice here that on the CLING there is a QR code for any patients who do have a smartphone. That QR code will take them to our website where they can find this brochure as well as all of the opt-out and revoke opt-out documents that they would need to complete. So quickly, just an overview of HASA in case you're not already aware. HASA is a nonprofit organization. We are providing HIE, Health Information Services, for Bexar County and 21 surrounding counties. What we are intending to do is make, as I said, medical information available no matter where your patients travel. So it will be, it is a choice that your patients can make. They do not have to share their information with HASA, and that is why that we have created these documents and we have set up the training based on all of our various stakeholders and their requirements to make sure that we are alerting patients. And there's a number of policies and guidelines to sharing with an HIE to make sure that we are HIPAA compliant and complying with all of the security and privacy documents that are consistent with your other internal processes. So quickly, I think it's probably important to note that HASA has adopted an opt-out policy for sharing patient information. That means that all of the information is being shared unless a patient specifically requests not to have that information shared. So we also have created, I'm going to pull up on the screen a document that is sort of some wording for suggested internal communications for your typical consent forms. So there's 3 paragraphs, and they're important because the first paragraph alerts them to HASA that you do share with an HIE, what we are doing, typically why we do it, and then what exactly it looks like and what they can expect. The second paragraph sort of details the fact that it is an opt-out and that they do have a right not to share their information. They cannot be discriminated against or refuse service if they do decide not to share. The third paragraph here is really because due to some system limitations, we do not have the granularity for patients to mask or hide certain data, special or sensitive diagnosis information like HIV, mental health, or substance abuse. So we need to make sure that patients are aware that this information will also be available in this. And if they are not comfortable with that for any reason, you should encourage those patients to opt out from the HASA system. But as long as if you're going through these documents and your patients are comfortable, they do think that that is a good idea, they want their information shared, then really at this point you as the patient access person needs to do nothing. If they have signed all of this, you've explained it to them, they agree, then you just file this internally and you have met the requirements as long as those other education brochures have been made available. However, if you are sharing this and for whatever reason your patients decide, no, I do not want that information shared, then there is an opt-out form. I'm going to pull that up quickly. So this is the opt-out form I mentioned. It's covered here. Let me see if I can cover that. So right here, it's just important things for you to be aware of. This is where you will put your location. So if you are working at, say, the downtown location at Baptist, this is what you would put up here so that if we have questions when we receive this form, and we can get in touch with you or we'll know where this form originated. So all 4 boxes need to be checked. This is sort of the legal documentation that the patient understands that if they do not share their information that these types of things will not be available. So that's important that they check all 4. This section here is where the patient information specifically for that patient goes, their name and date of birth and social, and then your patient will sign this. You see, if the patient is a minor, you can follow the normal guidelines for what your organization does for minors with getting consent. If you have a patient or whatever parent or guardian signs normally for your organization, that will be fine also for HASA. The last thing, the very bottom section here says to be completed by the notary public or a healthcare provider. This for your organization will be signed by you, does not need to be notarized. This is simply because we need to make sure that these patients are who they say they are, and we assume that as you are going about your daily job that you've already verified these people and know who they are. So if they were to download this form from the internet and submit it to us without a visit to a provider, then they would have that notarized, because we need to make sure that it's them who are filling out the form and not doing it on behalf of someone they're not authorized to do it for. So, but for your purposes, just sign here and put your phone number, and that is sufficient. At the very bottom of both forms that I'll show you, you'll see that the fax number is listed here. If you have access to the INEX HASA referrals platform, you can also submit it by going to HASA consent forms, which is searchable in the location field. So as I mentioned, your patients are going along, they say, no, I do not want to share, they complete an opt-out form, and then they have their encounter. That information will not be shared. That form will be faxed to us, and we will lock down that information so that it is not viewable to the community. Now, at a later date, your patient comes in for visit number 2, and for whatever reason they've decided they've changed their mind, they do want their information shared. At this point, and I think it's important to note too that even though most systems have the ability to scan these documents in and keep them on file by patient, it's probably important just to validate each and every visit that they still agree with the decision that they made originally. So are you sure? So I notice here, for example, that you opted out in January. Are you still comfortable with that decision, or would you prefer to share your information with HASA? So if they say, no, I still want to stay opted out, you really don't need to do anything other than clicking. If you have an electronic flag in your EMR, you would just, again, click no, they want opt-out in there. But let's say with that exact same scenario, the patient has changed their mind for whatever reason, they see the value of it, or someone explained it to them better this time around or something, they could choose to revoke their opt-out, which means their information will be back in the system. I'm going to pull up the revoke opt-out form. It's very similar to the opt-out form. So one box is checked here. Again, you put your provider location there, patient information here, patient signs there, and then you sign at the bottom with a phone number. These forms go either to the same fax number or to the HASA consent form sent here through the INEX platform as well. Okay, so back to the training document. This will be made available to, this is sort of a staff training outline. I've sort of been going along for this educational video through the outline here, a little bit about who we are, requirements, what we are required to do by facility. So make sure that you have included the template for those suggested, the 3 paragraphs that are the suggested language for sharing HIE. You have displayed the patient education materials appropriately with the CLINGs. We also have posters available that are sort of a more permanent feature. So if you run out of the flyers, you can have that available at all times. I've talked a little bit about both the opt-out form and the revoke opt-out form. I do, in this training form, there is the special consideration forms, but you can disregard that information completely if you have already deployed the suggested 3 paragraphs that we discussed earlier. The last thing that is important is it's important to know that if a patient does revoke their opt-out, the data will flow from the time that that organization began sending data. So, for example, your patient opted out in January, or let's say you work for ABC Family Practice and you began sending data in January. In January 15th, the patient opted out. Now they come back in June and they say, I'd like to revoke my opt-out. I've changed my mind. I would like to share. Then all of the information from the beginning of when your organization began sending data will be available for viewing. So we do not have, at this time, the granular approach to say, I just want this, from this date on. It will be everything or nothing. Think of it as a very large fire hose where everything is shared unless they turn it off, and then nothing is shared. So if you run out of forms, you can request more materials by going to the info@hasatx.org. You can always go to the website and call us directly at 918-1357 to request more. And then also the general time frame, we do have a help desk that is available 24/7. However, we typically handle the opt-out and the revoke opt-out forms ourselves. So we do have sort of a 72-hour window, a maximum window for processing these requests. If it's urgent, you can always contact the help desk, or we can make arrangements for your organization to be able to control some of that themselves. So we have ability to sort of customize this by organization that works best for you. But just in general, it could be up to 72 hours before these are processed, before they're opted out or revoked. It's just something for patients to be aware of and for you to let them know. So if you have any questions, you can, like I said, you can always call HASA or go to the info@hasatx.org for more information. We'll be happy to come out and do a training session with your staff if that is easier. But otherwise, I thank you very much for taking the time to talk about patient consent materials today, and hopefully we'll have that ready to go very soon. So thank you very much. Bye.